Okay, so we're rounding third here. Rather than spend a lot of time talking about Aspen Valley Hospital, I'll just give you a brief introduction. We're a critical access hospital in Aspen, Colorado, on the western slope of the Rockies. And we have about $100 million in net revenue. But importantly for our purposes, we have about 500 employees, $45 million in payroll, 67 housing units, because we are such an expensive place to live, and housing is particularly expensive, as are our labor costs. And what I want to talk about today really isn't us, but it's the collaboration that we have built among other hospitals on the western slope of Colorado to solve a similar problem. And that problem is the high cost of health care. And that's really what we're talking about today, or I want to talk to you about, is what we do as hospitals to come together and be part of the solution. This is the service area for Aspen Valley Hospital, and that is I-70 extending from Denver to the border with Utah at Grand Junction. And in our area, our uninsured rate is 12%. In just our service area, it's 17% in the mountain region where we have the resort hospitals. And we also are the 6th highest state for hospital reimbursement costs in the country, as indicated by the slide below. The problem with that is that our employers have said they can't afford coverage, and we have too many uninsured individuals. So the Colorado legislature and the governor's office have taken notice across the state of Colorado, and they have a number of legislative efforts that they have enacted in an effort to try to address the problem. And we, in our community, though, believe that we can address it better by coming together, and in particular, the rural areas are at an advantage because we have the opportunity to actually control the costs through population health management. The items that are on the right-hand side of this table represent higher risk to hospitals, and the higher they are in the table is the greater likelihood that they're going to be successfully passed. And as a matter of fact, along the top, those are items of legislation that have already passed and that we are all contending with. But in the middle, you'll see total costs of care targets. This is a counter-proposal to something called the public option, which I won't spend time talking about this morning, but it's essentially state government rate setting that you can see on the right-hand side near the top. The Hospital Association in Colorado has proposed total cost of care targets. And this is something we're going to be introducing to say this is a better way for hospitals to be part of reducing the total cost of care. Some years ago, back in 2015, the hospitals on the western slope of Colorado said we need to be part of the solution. We need to be able to reduce the total cost of care. And so we wanted to work together to bridge that gap from volume to value, to build a common infrastructure between us, to learn best practices among us, and to enhance our value performance. So the Community Care Alliance was formed. This is owned by a collaborative of 22 hospitals in western Colorado called the Western Healthcare Alliance. And it was formed for the purposes that I just described with 3 goals. To build that common infrastructure, learn best practices, and enhance the ability to perform in a value-based environment. But we wanted to target specific defined populations that we could help manage. And so in 2016, we created the model for value-based care, which I'm sure all of us are familiar with and we're learning about, which is essentially the quadruple aim. Our objective was to make sure that we maintained high quality and reduce the costs. This was the shift from conventional health care to population health management. So the first population that we decided we wanted to try to manage and learn from was through the Medicare Shared Savings Program. So we formed 2 ACOs that together served about 15,000 lives, and we actually were able to demonstrate superior performance in this program, and we saved Medicare $12 million over 3 years and actually received some shared savings back to repay some of the infrastructure costs, all the while maintaining quality performance above 95%. This was something that demonstrated to us a proof of concept. We knew after having served this Medicare population for 3 years that we could be successful, and in fact, we formed a new ACO last year called the Western ACO that serves, you can see the area in green, it serves 10 communities, 9 communities in western Colorado and Moab, Utah. So we truly are crossing state lines, and this again is about hospital collaboration working together. So up in our own region, in the area served by Aspen Valley Hospital, and our neighbor and partner, which is called Valley View Hospital, we have an alliance of employers that have come together to say, we want to work with our provider community to reduce those costs of care. You can see we have our major municipal employers and our ski company. This is what represents the major economic base of our community. And our own hospitals, ourselves and our neighboring hospital, our employees are part of this initiative. And so we purchase the services from the Community Care Alliance, and we build upon the same system of care that's been proven to be effective with the ACO. It's essentially a primary care model that has care coordination. We have data analytics to provide risk stratification, and we train care coordinators to manage the sickest part of the population that, as we know, the top 10% drives almost 70% of the cost of health care. Chronic conditions drive about 75% of the cost of health care. So now, in our community, I mentioned at the very beginning that we have high uninsured rates. And there's a lot of pressure in our community to say, what can we do to provide access to more affordable healthcare premiums? So we are starting to work with commercial carriers on a value-based basis to say we can deploy the same resources to help provide a local health plan with lower premiums, and that will be launched in 2021. Thank you.